Hello and welcome to Cox Connections. I'm your host, Gary McCullum, Senior Vice President and General Manager for Cox, Virginia. Each year, doctors treat more than 3 million sports-related injuries in children and teens. And because these are young growing bodies, it is critical to properly address their unique needs so that these kids can continue participating in sports as a lifelong health activity. Unlike Tracy, who returned to the basketball court too soon after suffering from a concussion. Let's take a look.
It was January 10th, 2005. I was 17 years old, and my high school basketball team was playing a varsity game, and it was around the second quarter, and I was going up for a rebound, and as I came down, the back of my head collided with the top of another girl's head. The next day, after the day I got hit, I went to school, and I was really sick. I knew I had a concussion because I suffered through a concussion my 7th grade year. I had all the symptoms, dizzy, nauseous. I couldn't focus in school. I continued to play a second game after that, and I passed out after the second game in the locker room. Basically, I was bedridden in my house for about 6 months straight. I slept on the couch because of the light. We had to put dark sheets over the windows. My mom and my sister had to help me walk around. I lost my balance. I couldn't really get that back for quite a while. I didn't know it could get this bad. All athletes have a strong will, and since we're young, we know that we have to suck it up, suck things up, whether, you sprain your ankle or you hurt your finger. You just go in the game and you shake it off and you don't complain, you don't cry. But this is a brain and head we're talking about, and you can't suck it up. So unfortunately, instead of missing a game, I missed the season. I missed sports for the rest of my life, and I missed out on a great life that I could have had. Athletes need to know, if you think you have a concussion, don't hide it, report it. It's better to miss one game than the entire season. You can find information on concussions at www.cdc.gov/concussion in youth sports.
Joining me today is Medical Director of CHKD's Sports Medicine Program, Dr. Joel Brenner, who works with a team that specializes in the prevention, diagnosis, treatment, and rehabilitation of sudden injuries, as well as those caused by chronic overuse. Welcome to the show.
Thank you for having me.
Dr. Brenner, Tracy's experience is not unique when it comes to returning to a sport too soon. Why did CHKD create a program just designed for young athletes?
Well, Gary, we knew that there was actually a need in the community for a comprehensive sports medicine program for young athletes, including children, adolescents, and young adults. And our program includes sports medicine and physical therapists, certified athletic trainers, pediatric orthopedic surgeons. Some are also fellowship trained in sports medicine surgery, along with sports medicine physicians such as myself and my partners. And as part of our program, not only do we see patients and athletes on the field in the office, but we also have special prevention programs such as for dancers, for swimmers, throwing athletes. And we also do a lot of educational outreach activities to reach the young athlete, the parents, the coaches, and other healthcare professionals to teach them about injuries and other things that we can do to keep athletes healthy.
We saw this in the video with Tracy, but talk about how important it is for young people to be fully healed before they return. What are the risks if they come back too soon? She alluded to some, but from a professional's point of view.
From a concussion, we need to remember a concussion is a brain injury. It's not just a ding or just a bonk on the head, but it's a brain injury, and really the brain is the future for that child and that young athlete, and we really only get one chance to treat it. So if you don't recognize that you might have a concussion and you don't treat it properly, there are some significant consequences, such as second impact syndrome. If you go back to sports or physical activity too soon after having a brain injury like a concussion, and you get a second one, that can cause brain swelling, which can cause permanent brain damage or even death. Wow. You can also get post-concussion syndrome, where the symptoms of a concussion can linger on for weeks to months, even years, and now through some autopsies and other research, we're seeing some chronic brain changes that are similar to people with dementia.
And so what is the best method for treating these young athletes with a concussion?
The first thing we need to do is recognize or suspect that someone has a concussion. And if you just suspect it, then you should pull that athlete out and have them evaluated by an appropriate licensed healthcare provider. And then the treatment really is rest in the brain and rest in the body. We call that physical and cognitive rest, and sleep. And it's really giving the brain a chance to heal with time.
Dr. Brenner, what are some of the other conditions you come across with young athletes?
We see a variety of joint and muscle problems, sprains, strains, fractures, stress fractures, dislocations, medical problems such as heat illness, female athlete issues, and just exertional problems such as fainting, chest pain. We also deal with a lot of sports nutritional questions, hydration questions, just the whole gamut
of things. Now, I was a big sports person, as a child, and I understand you're the lead author of the American Academy of Pediatrics' new policy on overuse injuries. I want to get this right: overtraining and burnout in child and adolescent athletes. So is there a such thing as too much sports for young folks?
There definitely is. We want to find that happy medium. There's this obesity epidemic, but we want to find this middle ground where kids are being active but not too active, where they're causing injuries both physically and mentally.
And what constitutes too much training or too much exertion?
Right.
What
The recommendations that we have out right now is that you have at least one day off from your particular sport a week. And then also at least about 2 months off spread out throughout the year from your particular sport. So you can be doing other things, you can be cross-training, you can just be out there, especially for the younger kids, just being a child and doing non-structured play.
Well, what about those folks who say that in order to stay competitive, it has to be all year round, you have to stay at your sport and really get good at it? What do you say?
We know that's not true. I was just at a conference with some ex-Olympians, and they even said it's not true. You need to have a break both mentally and physically so that you don't get burned out.
And so what are some of the signs when you start to see this in a child that they clearly are training too hard or getting burnt out?
They might start getting more injuries, they might aches and pains, they lose the enthusiasm to really participate, school performance might go down, and they're just kind of acting a little bit differently.
We're almost out of time, but I have to ask you, what advice are you going to give to a parent or a child listening to this about this issue, or coaches for that matter?
Yeah, well, I think we need to remember is that the goal for sports is to make sure that kids are having fun, that they learn lifelong physical activity skills so that they can then participate for the rest of their lives.
Dr. Brenner, thank you so much for all you're doing and for all you're doing for our young athletes.
Thank you.
After the break, this one-stop facility provides the critical support military members and their families need when serving our Commonwealth and our country. Stay tuned for more Cox Connections.